Good morning. My name's Beth Roper. I am a master's student at App State University, and I will be presenting my research proposal, Pediculosis capitis, Evidence and Emotion. This morning we'll be going over the problem that I have seen, the literature that backs up the research that I would like to do, project aim, learning objectives, learning theory, methodology, and assessment. So the problem that I would like to address this morning and do research on is we have had a policy change, and this policy change, which allows students to remain in class with pediculosis capitis, is challenging for educators and support staff, despite evidence that the risks of sending students home with pediculosis capitis can be detrimental. Some of these risks include financial burdens, parental time lost from work, loss of instructional time, and potential for abuse at home. And then they also have potential for social and emotional consequences, and that leads to a lack of school belonging, which then leads to, in some cases, a lack of success. Their social belonging at school can lead to a more academic success in the long run. So this is a problem that I would like to address with staff. In regards to literature about this, the first literature I started looking at was diagnosis and policy. So diagnosis and treatment, students are potentially excluded due to misdiagnosis. Once the infestation is identified, it is likely that that student has had pediculosis capitis for approximately a month already. And then financial burden and time out of work is also a big thing that the research talks about when it comes to being out of work for this situation. As far as policy and position statements, policymakers support that students with pediculosis capitis should stay in school because the benefits of staying in school far outweigh the risks, as we've talked about. It has been the position of the National Association for School Nurses, Centers for Disease Control, and American Academy of Pediatrics that the no-knit policy is not the standard of practice anymore, and it's been that way for over 20 years, according to Centers for Disease Control and Prevention and Kern et al. And Nault et al. 2022. So when looking at an education intervention for staff, the literature reminds us that school staff, what reminds of their calling to help students succeed. Staff are able to help students succeed by attempting to remove barriers to their education. And following outdated policies that are based on feelings or emotion rather than evidence can create significant vulnerability for students and families, according to Kumar et al. 2021. The social stigma of pediculosis capitis can result in psychological distress due to the student becoming the object of gossip, laughter, and ridicule. A student's self-worth is very reliant upon the social groups that they associate with, and losing the support of friends is detrimental to the student and their overall psychological health, as well as their sense of school belonging. In order to decrease the amount of stigma that students and families face, it is of utmost importance to dispel myths surrounding the condition, according to Banafshi and Katani 2024 on page 12. So this is the important pieces of educating staff. We want to make sure that we are talking about all of these things in a way that they can understand and relate to. So as I go through this research, my goal is that this project would present evidence-based research that will support the rationale for the pediculosis capitis policy change, and also exploring and encouraging empathy in teachers and support staff to respond in a compassionate manner to students that are diagnosed with pediculosis capitis. And hopefully the outcome will be that the end result is ultimately compassion towards students with this condition and a reduction of the stigma that students face when diagnosed with pediculosis capitis. And the use of empathetic communication and reduction of stigma will ultimately lead to school belonging, and then school belonging to academic success, according to Kai et al. 2023. And that is what I think that that is a goal for all educators and people that are working in the school system, hopefully. So with this research, there are some learning objectives that I would like to try and achieve. Foundational knowledge. The learners will know how to be empathetic and why empathy helps students with head lice. Application. Learners will demonstrate the use of empathetic verbal and nonverbal communication. Integration. Learners will integrate empathetic behaviors within simulation of their everyday interaction with students. Human dimension. Learners will acknowledge personal barriers in order to be empathetic towards students who have been diagnosed with head lice. Caring. Learners will value demonstrating care, compassion, and respect for students with head lice. And then learning how to learn. They will commit to ongoing practice and improvement of empathetic communication with students. The learning theory that I'll be using to perform this educational intervention and research is the Transformative Learning Theory by Jack Masrow. At the center of this theory is the concept of transformation. Transformation is a holistic self-assessment shifting of ideas. One should evaluate their current frame of reference, assumptions, opinions, and expectations, and then use that self-reflection to guide themselves into a more open mindset, according to Masrow and Taylor, 2009. And then when professionals are able to have an open-minded discussion among each other, positive change is likely to be evoked. So the learning theory that I'm using does have 10 phases of learning. Those 10 phases are listed here. So we've got a disorienting dilemma. So we've got, a child that has a case of head lice. We want to do a self-examination and assessment of what our feelings are towards that child, and then a critical assessment of our assumptions. Then we want to recognize a connection between one's discontent and the process of transformation. We want to explore new options for new roles, relationships, and action, and then plan a course of new action. And we want to acquire knowledge and skills for implementing one's plan, provisional trying of new roles, building competence and self-confidence in new roles and relationships, and then a reintegration into one's life on the basis of conditions dictated by one's new perspective. So what you have here is a process of starting out with one thought, self-assessing, being open-minded to listen to research, and then evaluating what your new perspective would be. An honest and open self-assessment, presentation of research, and then clear instructions to move forward are essential to the success of this research project and promoting empathy among educators, and that is what I have aimed to do in my presentation. So the audience, we're moving on to methodology. The audience is going to be K through 5 elementary school teachers and staff. The educational levels are ranged from high school graduation through doctoral preparation. And although these professionals may be very educated, it will be important to acknowledge that teachers and staff do not have medical training or education. Therefore, I will make sure to use terms that are familiar to the general population when discussing medical needs and interventions, so that we can all have a better chance of understanding and know how to ask questions and things like that. My proposed educational sequence will be a pre-survey will be sent out by email prior to the educational offering. It should take about 10 minutes, and I have modified the Jefferson Scale of Empathy for educators. This educational offering will be in the form of a 1-hour presentation. This presentation will utilize active and passive learning, and the sequence of the workshop is as follows. So I'll be doing an introduction, and it should not take but about 1 minute, and then slideshow presentation. I will introduce a topic. We'll talk about emotions, research, policy change, empathetic responses, and that should take about 15 minutes. Some of the slides are more interactive than others, and it will be asking for input from the audience of learners. And then there will be presentation of learning objectives, definitions with empathy, with a video. We will discuss verbal and nonverbal communication. We have a large group participation game, so this game will take place with the whole group. and it will be asking if a statement's empathetic or not and soliciting a response from the students. And if it is not an empathetic statement, a discussion will take place on how we can make it an empathetic statement. Then we'll do small group discussion with discussion prompts. Now, some of these groups will have 4 to 5. Some of these groups may have up to 10. So just depending on how many we have will be the large group and small group will be divvied out that way. When I'm talking about a small group, I want to have about 4 people in a small group. So if I do have a group of 10, we'll be splitting up for that. And then the large group, of course, will be the entire group. And in some cases, again, I may have 4 people, and so the large group and small group will both be essentially the same. And then at the end, I will provide a role play exercise that I plan for these learners to take part in that will give them different scenarios and different roles to play so that we can talk about how we would respond if we were the nurse, the parent, the teacher, or the student in different scenarios. So there'll be a scenario where a student only speaks Spanish that is being treated for head lice. There will be a student who has multiple cases. It actually says that he has or she has the 10th case of head lice that they've had this year, and it's only December. There's going to be a first-time head lice patient, and then there will also be a parent who's coming in to state that they feel like they've been misdiagnosed, and how are we going to handle all of that with empathy. So I'll be able to give feedback regarding their responses right on spot, just so that we can all learn together. And then methodology by learning objectives. So the foundational knowledge objective, I'm not going to read that over again because we've been through that, but I did put the objective back on this slide. But I plan to achieve the foundational knowledge objective by giving a presentation, and I want the presentation to be easily understood and give real life scenarios to help the learners connect the concept to real life situations. The application objective I plan to accomplish by participating in a game in which students will identify empathetic statements and non-empathetic statements. And again, when we do the empathetic statements, if they're non-empathetic, we will be changing that to portray empathy right there. The integration objective, I would like to accomplish that by educating the learners on the importance of engaging with students empathetically in everyday interactions due to the positive impact that it has on school belonging and in turn on academic success for students. Human dimension, I would like to accomplish that by doing the assessment prior to class and 2 weeks after. And these things will also be discussed in small groups. So here we're talking about personal barriers. So we will be talking about that in small groups, and we'll be self-assessing prior to the class and after. The caring objective, I hope to accomplish this objective by observing the students while they are working in their role play exercise with their small group. Learning how to learn, I'm hoping that I will accomplish this by helping students to move forward using the most current evidence-based practice in an empathetic manner. And then as far as assessment of how the educational intervention goes, we will be giving a post-survey as well. It will be sent out 2 weeks after the workshop, and it's to determine if feelings and attitudes have changed based on the educational intervention. Again, I will be using that Jefferson scale of empathy again, and we've modified it for educators. The post-assessment will be compared with the pre-assessment to determine the success of educational intervention on empathy towards stigmatized conditions. In order that people will be able to answer in an open and honest way, we have made the assessment to have a link that the teachers will make up based on some directions that we've given them, and I will be able to link the pre-assessment to the post-assessment without being able to identify my learners. That way they feel like they have the ability to be open and honest with this so that we can get the best assessment of how things are going. And then these are the references that I used for my research so far, and I look forward to getting started on my research. Thank you.